Good morning. My name is Abby Katz, and I'm a medical student at Mount Sinai, and today I will be talking about intraoral laser hair removal. I have no disclosures. The present scoping review was inspired by a case report at our practice. A 42-year-old male presented to the clinic complaining of intraoral hair growth. He described his symptoms as extremely distressing and was having difficulties eating and chewing. His medical history was significant for an oral tumor that was treated with excision and reconstruction using a fibular free flap 8 months before. This was the first time we had seen this at our practice, and so we decided to treat him with intraoral laser hair removal. We chose the long-pulsed MD YAG laser because the diode laser in our office did not fit inside the patient's mouth. He underwent 2 treatments approximately 5 weeks apart and was successfully treated. After this patient, we were curious if other groups in the literature have also treated this problem with intraoral laser hair therapy, and so we performed a scoping review using PRISMA guidelines. Here is an overview of our PRISMA flow diagram. We extracted studies from Embase, Medline, and Scopus. Screening was done by 2 independent reviewers, and in total, we included 21 articles. Here is a table of the data we extracted from the articles, including general information, patient information, and laser information. For our results, in total, we identified 77 patients treated with intraoral laser hair therapy. The average age was 54, and the population was predominantly male. The most common reason for hair growth was post-flapper graft reconstruction, and the most common donor sites were the radial forearm and the fibula, all of which are hair-bearing areas. Similar to our case, more than half of the studies documented severe distressing symptoms from the hair growth, and one patient even had partial airway compromise due to the location of hair in his pharynx. Here is a big table of the extracted data that I'm going to break down. Starting with laser-specific information, the majority of patients were treated with the alexandrite laser, followed by the MD YAG and diode. Patients needed between 1 to 7 sessions, with an average of 3.8 sessions needed. The average time between sessions was approximately 5.4 weeks. Now, looking at response to treatment, complete response, defined as an 80% or greater reduction in hair growth, was achieved in 90% of patients. 8% of patients achieved a partial response, and 1 patient did not respond because of his gray hair. Overall, treatments were extremely well tolerated without major side effects. One limitation that was shared by many groups was difficulty accessing the intraoral hair due to the size and shape of the laser headpiece, which we also experienced at our practice. Here are some photos demonstrating the reduction of hair after laser sessions, with some of the settings listed for your reference, and at the top is our patient. In conclusion, intraoral hair growth after flapper graft reconstruction is a prevalent side effect in the literature. Symptoms can be extremely burdensome to patients and may even be life-threatening in rare situations depending on the nature and location of the hair growth. In the literature, laser hair therapy has successfully treated this condition for many patients and may offer a viable treatment option, although further prospective research studies are warranted. We also would like to emphasize the need for surgeons to discuss and disclose this post-operative outcome before surgery, and when possible, encourage patients to undergo pre-operative laser hair removal from the donor region. And even if there isn't enough time for patients to complete all of their laser sessions, undergoing even just 1 session pre-operatively can reduce hair by 10 to 25%, which may benefit patients, and if needed, subsequent sessions can be restarted after they recover from surgery. Thank you to my team at Mount Sinai for making this possible, and thank you to the ASLMS conference for allowing us to present our work.